Hey everyone. Today I wanted to share with you a segment of the online course that I created, Foundations in Anatomy and Body Science for Yoga Teachers. Now this is a 10-hour online course and it's the first segment that I do in the 30-hour segment that goes into our 200-hour yoga teacher training. And I wanted to take this information and put it online because I feel like a lot of people struggle with the anatomy portion in their yoga training, and it can be helpful to go back and watch it over and over and really absorb the terminology and get comfortable with all the information, because that's how we start to build on that foundation and create a really solid understanding of our body and how it interacts with this practice of yoga. So I hope you find this segment to be helpful, and I'll put a link in the description below if you want to check out the full course. Now we're moving into the joints of the axial skeleton. So all those bones that we've talked about and we have learned the names of, now we can use that language to start to talk about where these bones are actually meeting and what's happening at those meeting points. And then this is where things get a little bit more applicable to what's happening in our yoga practice. So you can really start to see, especially with this section, how anatomy is like this layering process and one builds on top of the other. So we have to go through that process of learning the names of the bones and all of these little different bumps on them so that we can understand the joints, so that we can understand the muscles. All right, so here's another picture that I pulled out of my old college anatomy book, and it shows you the axial skeleton there. Skull, cervical, thoracic, lumbar, sacrum, coccyx, and the thoracic cage. And those are the ones we're actually going to go into more detail with. So here's a list of them, and this is where you start to realize that some of the joints just have these absurdly long, complex names. And a lot of times it's because we take the name of two bones and we stick them together to try to describe that joint. So the idea behind it is really to make it simpler so that you understand what's creating that joint, but the end result is like this really long, crazy word like the temporomandibular joint. And a lot of times what we'll do is have an abbreviation like TMJ is a term that maybe you've heard of for the jaw right in here. That's usually a lot easier to say than temporomandibular joint, but we're going to start with a non-synovial joint, so the suture joints of the skull. These are the fibrous connections between the flat bones of the skull, and there's some crazy names right there. Just be really happy that you don't need to know any of those. Just know that they exist. That's the important thing, at least for what we're doing right now. All right, so first joint up is the temporomandibular joint. This is the joint of the jaw that allows us to chew, and it's a joining between the mandible and the temporal bone of our skull. So, temporomandibular joint. It is located just anterior to the tragus, and the tragus is this little bump on the inside of the ear. The reason that I know that is because I had mine pierced on each side, but if you find that and then go directly forward and then open and close your jaw, you will feel that moving. So that's your temporomandibular joint. And this is a weird joint because it is a synovial joint, so it has a joint capsule and it has synovial fluid inside of it, but it also has an articular disc, which kind of divides it into two separate joint capsules. And it's technically an ellipsoid joint, but it has some specialized movements that go beyond your typical ellipsoid joint. And that's because when we chew, we do some really complicated movements. It's not just up and down. There's like some sideways to create more of a grinding effect with our food. And when people have a lot of issues with the TMJ joint in terms of yoga, one of the things that I would try to do is to create a program that really works on posture, because when the head is super far forward of the shoulders, it can strain all of the muscles up the neck. They're working too hard. So that's going to affect up into the jaw and up into the skull, sometimes related to headaches and things like that. All right, so in yoga, what we would actually work on for this joint would be Jiva Mudra, which is where we take the tongue to the top of the hard palate right behind the teeth. I love that mudra as a way to relax the jaw muscles. So you tell your students, put the tip of the tongue right behind the teeth and then relax the jaw so that there's space in between the teeth, because so many people, especially ones that suffer from chronic stress, are going to clench their teeth unconsciously. Tightening of the jaw muscles is a really common thing that we see as a stress response, and that's because it's a protective technique that the body has, that if we are in a potentially dangerous situation, we lock the jaw into place so that it's less likely to be damaged if we got into a fight. Because if we can't eat, we would die. So it's a very protective mechanism, but in the long run, if you have chronic stress and it's not really life-threatening stress and you're constantly clenching your jaw, what it does is it can create really terrible pain. So as a preventative factor, there's all these things that we can do in our practice, like using Jiva Mudra, spacing top and bottom teeth, lion's breath, where we like stick out the tongue and open the mouth really wide to stretch those muscles, which we don't do very often during the day. And yoga tune-up, which is Jill Miller's program. I'm a huge fan of the yoga tune-up balls that we use to roll, and she has a whole program that you would do for the face and the neck that you can see here with the block. Very effective for manually getting some of that tension out of there. All right, so we talked about these bones, specifically the atlas, that guy who's like carrying the world on his back, and that is literally what C1 does. It carries our giant heavy skull on top of it. And that C1 is, we think of it like a rocking chair. So the skull sits on top of it and it can rock a little forward and back. It's like a little divot on each side. And I know I have another picture of that. Okay, so there's that Atlanto-Occipital joint where this little diamond is. So the occiput being that backbone of the skull, and then that joins with the atlas, that top bone of the cervical spine. And we put that together to the Atlanto-Occipital joint, or we could say 0 and C1. So 0 being the skull. It's not part of the spine, so it doesn't get a number. And then here's our movements. So neck flexion and extension, and neck lateral flexion. Then we get to the next joint down, the atlas and the axis. So there's where that pointy part called the dens pokes up inside that big center ring of the atlas, and it allows a lot of cervical rotation. So right there, we have all the major movements that our neck does, really almost taken care of with C1 and C2, and we're ready to go. But that's where we can see how the upper cervical is really going to give us a lot more movement than the lower cervical. So upper cervical is mobile, lower cervical needs to be stable. So there's our movements for the Atlanto-axial joint, the atlas and the axis sitting on top of each other, getting that really good cervical rotation. So cervical rotation in a seated twist, cervical rotation in a supine twist. So a joint that gets a lot of attention in yoga, the intervertebral joints. And this is where we have those famous discs that we hear so much about. There's our little diamond. So we're showing the body of one vertebra and the body of another vertebra. There's this big articular disc in between there. And these are discs that are made of what's called fibrocartilage, really strong type of cartilage, very fibrous. and it creates this ring, like a donut. And then we have this kind of squishy jelly substance in the middle called the nucleus pulpus. And that is like the filling of the jelly donut, right? So picture a jelly donut, and you're stacking one hand on top of it and one hand underneath it, and you can bend one way and the other way, and it kind of squishes or forward and back. And if you put too much pressure, it would squish that internal jelly in one direction or the other. Now, don't think that that's going to happen really easily because, right, tough fibrocartilage, strong. In a normal, healthy spine of somebody who's active and this gets massaged and has a good fluid content, pretty durable, right? But we know that people get herniated discs. We all know somebody who's got one. And that's something that happens when this tissue is not healthy and then some sort of force is applied to it that causes that internal pulp, that internal jelly to get squished in a certain direction. And the one that we hear about is when it gets squished toward the posterior, because that's where the nerves come out and that's the one that's going to be painful. But you can also just have normal age-related changes to these, right? We kind of dehydrate as we get older. We don't have as much fluid in our tissues, which means that they're not quite as resilient, and that is all a normal part of aging. So here's just another breakdown of the intervertebral joint that gives you a better look at the nucleus and then the outer fibrocartilage that creates the disc in between each vertebra. And then there's the body of the bone underneath it. So there's not a ton of movement at this joint. It is an amphiarthrosis. And remember, we talked about amphiarthrosis as like an amphibian. Sort of does this, sort of does that, but it's not really super great. So it's not going to move like your shoulder. It doesn't have that much movement, but it has a little bit of movement as that disc allows us to kind of squish it in all different directions. It gives us this amazing balance between being able to move, but maintaining stability and support at the same time that just works so perfectly well. Here's another view of the disc, and I like this view because you can see that you have that fibrocartilage encircling that jelly or the pulp in the middle, and then you have ligaments and ligaments providing support, linking bone to bone, and then you have an end plate on the top and the bottom of the disc, again, adding some structural stability to that disc. Now, when we're talking about spine movements, this is one of the first places that I like to introduce this idea of biomechanical forces because we see so much of this in the spine, but it's really happening to all the tissues in the body. You can just really visualize it at this point. So there's tension. When we pull something end to end, and in the spine it would be that axial elongation is actually going to tension the tissues, and tension is not a bad word. Sometimes yoga teachers like to pretend that it is, but it's not. The body needs tension. Compression. So if we're in headstand and the force of gravity is pushing one end of the spine toward the other end of the spine, there's going to be compressive force. We would also get that if you jumped down a series of steps and landed on the ground, there would be a compressive force associated with that. Torsion is what happens when there's rotation, kind of a diagonal pull. And then shear would be like pulling on opposite ends of a piece of paper, like that. This diagonal pulling away. Okay, so you can see how when we do the movements of the spine, all of these forces are acting upon the spine. And that's okay. We want some beneficial stress, right? We looked at that continuum. If we get too little stress, it causes the body to deteriorate because it's not getting enough input. If we get too much of these forces, that's when damage is caused because the tissue fails. we want to sit somewhere right in the middle there where we're getting all of these different forces, which is going to tell the body to upkeep the tissues in a way that's really strong and therefore preventing injury. If we do find ourselves in some sort of like a traumatic situation like an accident, we're less likely for those tissues to rupture or tear or be injured because we gave them the proper amount of stress consistently for a long period of time, so they were more resilient. All right, so here's a really great depiction of this from Sequence Wiz. I highly recommend that website. Really, really good graphics if you are a visual person. But this is what happens. We have compression here, and you can see it's like pushing out the sides of the disc. Totally normal force, right? There's always compression, there's always gravity. And then we have forward bending, so the anterior portions of the vertebra get closer together, and the posterior portions get farther apart. So the jelly would be getting pushed toward the posterior part of the spine. And then we have back bending, the opposite. The jelly gets pushed toward the front of the spine, the anterior. And then you have side bending, one side and then the other. And then you have rotation, so you're getting that torsional force. And force is not bad, tension is not bad. If it's too much, where it causes tissue damage, then it's bad. But in the context of just normal movement, all of these things are going to create more resilient tissue when we do them at the appropriate level and we apply them consistently. So important. The body really responds to what it takes in consistently. So then here's just a few examples of the movements of the spine that you're going to find in yoga poses. We do a ton of forward folding, a lot of back bending, lateral bending, twisting, and then axial extension. And then this is a super interesting little graphic here. So this is showing you how much force they were measuring within the intervertebral disc in different positions. So this is something to take into consideration if you're working with somebody and they tell you, oh, I have a herniated disc and it hurts in certain positions. You can kind of keep this in the back of your head. So the lowest pressure in the disc is when we're flat on our back, completely supine. That's almost always where I start anybody who has a back problem, unless they have increased pain in supine, then I don't do that. But that's usually first thing I go to in my head if somebody comes in and I have back pain, usually start the sequence in supine. Next is side lying, and then the next is in standing. So watch how much the pressure jumps up standing straight versus standing bent forward. Not the greatest posture. And then standing bent forward holding a weight. So think like a bag of groceries here. We jump up to 220. All right, so what about sitting? If you're doing chair yoga, you're at about 140 for the pressure there, and then you slump forward the way a lot of people sit, and you're at 185. The highest pressure out of anything is if you were sitting, hunching forward, and holding a weight in your hand. Right? Kind of surprising. You might think that it would have been standing, but sitting, worse. Okay. So an important joint to talk about is the space where the cervical and the thoracic meet. And really all of the places where we transition from one spine segment to the next are important because it's where we change direction of curve. And that creates a point that is a little bit more vulnerable to strain. But especially C7 to T1 is really a spot that sees too much pull because of forward head posture. And there you have that little chart that we see sometimes of 15 degrees forward, it's 27 pounds of force. 30 degrees forward, it's 40 pounds of force. Our heads are heavy. And if you start to move that away from its base of support, the neck muscles are working super hard, and this poor little joint is taking a lot of strain. But it's not just bad posture that puts stress on this joint. If we do shoulder stand in that traditional fashion where we are flat on the ground, this is like a 90-degree angle. This is a ton of cervical flexion, and it's cervical flexion that we're asking for from the lower part of the neck. not the upper part of the neck. And we know that that can be problematic because when we are looking at where the movement comes from, the upper part of the neck is supposed to be mobile. So the way that we kind of fix that is we stack blankets under the shoulders so that the head is resting on the floor, but it's less of an angle, it's less flexion in the neck, and therefore less likely to strain the lower part of the neck. All right, so then we go to the next transition point, which is T12 to L1, and there we have it right there. This is the area that has the most incidence of burst fractures. So if there's a compressive force that the bone is not able to tolerate, the body kind of breaks out into pieces, and they call that a burst fracture. Kind of pretty common with somebody who has severe osteoporosis, where the bone is just not able to take the stress. All right, so the facet joints of the spine, these little contact points, they are plane joints. So one connects to the other one so that they can kind of slide past each other, and it creates this really nice integrity to the spine. It like interlocks one vertebra with the next, and it allows for a good amount of movement. So most of the movement that's happening here is flexion and extension and rotation. It's also really helpful for transferring load throughout the entire spine so that it's not too concentrated in one area, less likely that that area will get damaged or injured. We want to distribute it evenly through these contact points. All right, so another great graphic from Sequence Wiz. Here you can see some examples of forward folding, back bending, and twisting. So the three main movements that we get from our facet joints. Coming back to that idea that the movement available to us is not just about what our muscles can do, it has a lot to do with the shape of our bones. And for the facet joints, there can be different angles to them, right? So the way that the vertebrae are interacting with each other is going to determine how much rotation you're going to be able to have, how much you're going to be able to back bend, how much you're going to be able to forward bend. Don't force it, because when we force it, that's when we're going to start to see tissue damage. It's just not worth it to get that extreme back bend and really risk doing some sort of damage to the facet joints of the spine. We kind of talked about how each of the bones in the three segments of the movable parts of the spine have a different shape, and that gives them a different function, a different amount of movement. And here's a great picture of that. So the angle of the facet joints at the cervical spine is like that. And then in the thoracic spine, it's a really strong angle. And then in the lumbar spine, it's a really strong angle. So that is going to determine how those three different segments really have different amounts of movement available to them. And then you throw in individual variation where one student versus the other student is going to have a slightly different angle in each of those areas of their spine. So they're going to have different ranges of motion. And we just need to allow there to be differences. So this lovely color-coded picture shows you the ligaments. So ligaments being part of the skeletal system that links bone to bone. It creates stability and it limits movement. It links and it limits. So lots of things going on there. Happy that we don't have to memorize those. All right, so then we have the connection between the ribs and the thoracic spine. The vertebro-costal joints. Vertebrae plus rib or costal, and that is the name of this joint. So it's a synovial joint, but it's a plane joint, just like the facet joints. And you can see there that each rib is going to have a little bit of attachment to the superior and the inferior vertebra on the thoracic spine. There's another view of that. So here's the anterior, there's the body, there's the posterior or the spinous process, and we have that plane joint of the rib connecting to the body and then to the transverse process. So 2 different points of contact to create stability. This is a spot where I feel like we kind of neglect in yoga a lot of the time. These joints are essential to the movement of the rib cage when we're breathing. We need rib cage movement. We talk so much about the diaphragm, but the diaphragm is one piece of the puzzle. The ribs need to be able to move. Not a ton, but there's some movement there that actually creates the change in pressure that helps the air to go in and the air to go out of the lungs. So here's one of my techniques that I really like to do. You take a strap and you crisscross it at the front of the body. You hold the sides with just a little bit of tension so you can feel the circumference of the body. And as you inhale, you'll feel that expand. And as you exhale, you'll feel that contract. And it's all about trying to allow movement at the lower ribs, the middle ribs, and the upper ribs to feel if there's anywhere where it's hard for you to expand, or to maybe feel if you're over breathing in a certain area where you're like straining, or especially the upper part, that you're recruiting your accessory breathing muscles too much. The other part is this lateral breath. This is a great picture. I like to horseshoe my hands, put the thumbs behind the rib cage and the fingers in front, so that as you're breathing, you're feeling forward and back movement, but you're also feeling side to side movement. It should really be breathing in all directions. And then there's a version of that in supine. Okay, the front of the rib cage, you have the sternocostal joints. And this is where we were talking about the ribs, how some of them are special and they come over with that costal cartilage and they attach to the sternum. So the important thing here is there's really not a lot of movement here, right? We want to keep some pliability to the tissue. But one of the problems that I see most often is if somebody is kind of rounded, the first thing that a yoga teacher wants to do is get in there and do aggressive back bending and really aggressive heart opening. And I was in a workshop, I think it was the scoliosis workshop that I did. One lady, we were talking about working with kyphosis, with rounded posture. She said that she had an older client that she started doing all of this work with to open and open. She started to have pain in the front of her rib cage and went to the doctor and found out that she had inflamed that costal cartilage because it was too aggressive. It was too much, too fast. The body hadn't moved in that way and it was just too aggressive. So this is an area that can get inflamed. I know I did this. There was a period of time when I was doing a lot of arm balancing and a lot of chaturangas, and my shoulders are not super strong, so a lot of that stress was getting transferred to the center of my body, and I started to get a popping kind of thing going on with one of my ribs, and I would have a lot of pain in the side of the sternum when I would do any sort of weight bearing on my arms, and that was my costal cartilage or my sternocostal joints kind of yelling at me hey, you need to get more support from your muscles before you start trying to do those movements. So here's just another graphic showing you the rib attachment there to the body of the vertebra, and then the transverse process scoops around cartilage, sternum. There you can see the little indents of where that costal cartilage attaches to the sternum. And one more picture. There you can see those connections to the front. All right, so you have the sternocostal joints, and then you have the interchondral joints. So it's basically just taking the costal cartilage from one and joining it to the next, kind of a special joint. And then you have that point where the rib and the costal cartilage actually joins together. So then you would see this area getting attention when you're doing things like camel pose, heart bench and lung bench, that back bending over the blocks. This is a picture from Jill Miller with her soft, kind of squishy, it's called the Coregeous ball. She uses it for a lot of core work. So that's really nice for opening up the rib cage. But again, don't be too aggressive with that because you can actually inflame that area when we jump in there and start trying to fix things. All right, so is this the last one? It's the last one. All right, Lumbo sacral joint. This is your connection between L5 and S1. It's a change in curve, so we know this is a little bit more vulnerable than some of the other places in the spine. This is a very common site of injury that I've seen in my 10 years in healthcare. A lot of people have L5, S1 issues, disc herniation there, pain. So it's the connection between L5, the lumbar spine is movable, right? We talked about the flexion and extension, the 5 degrees of rotation, all that sort of stuff. But then the sacrum is the 5 fused vertebrae that come together into like one chunky piece at the back of the pelvis. And it is attached to the rest of the pelvis to form that ring. We'll talk about the pelvis in more detail because it's so important. But because we're talking about a structure that is a little bit more mobile and then a structure that is really not mobile, that's where problems can kind of arise here. And especially when we're talking about very end range forward bending and very end range back bending. Because think about this. So the sacrum here at the back of the pelvis, stuck, anchored with the rest of the pelvis, especially in a sitting position because our weight is here. And then I picked out this picture because this is exactly what students will do. They will grab their feet and then try to use their arms to pull themselves toward their legs to appear that they are going deeper into that forward fold because they think that's what the point is, to look flexible. And then what part of the spine is going to take the most pull? A lot of times it's that L5-S1 because the sacrum is planted and that L5 is the more movable part. So that's the one that's going to take the pull. Same thing when you're going into a back bend, right? Okay, so what do? This is from Sequence Wiz. Bring a little softness into the knees. You might hear different things about bending the knees in yoga. I'm a big fan of it. I think it makes people more comfortable. This explains why the hamstrings kind of play into that. All right, almost there.